you're in the chat box, please. And I'm on mute. So I can see Sophie from Derryford Hospital in Plymouth. Please do type in your name, what part of the country you're dialed in from, and the organisation. That would be lovely. And if you've got questions throughout the morning, throughout the event, please just put it into the chat box as well. I can see Lisa from CCG, Northeast Essex CCG. Lillian from London CCG. So got 3 people, Maddie Emma Clins from Worthing Hospital in Sussex. Nicola Booth from Calderdale CCG. I've got Jill from Stoke-on-Trent, welcome. Got quite a few people in the waiting room, so I'm just going to let them all in. Submit everybody. We've got Iram Naz from Blackpool, Catherine from Morecambe CCG, Rosie from eBug Team PHE. Who else? Let's see. Are we tweeting? Are we? Oh yes, hashtag Antibiotic Guardian. That's a very good point. Yes, you can tweet. It's hashtag Antibiotic Guardian. Thank you. Can't see who asked if we're tweeting. It says no title. I've got Carlos from Homerton Hospital. Soraya from Milton Keynes Hospital. A few more people in the waiting room. Excellent. We've got 36 people online already, which is brilliant. Got Trisha from Darlington. Oh, rainy Darlington. Oh dear. So if you're just joining, if you could please go on mute, that would be great. So I've just muted everyone. Please stay on mute. Also, have your cameras off. The speakers will please have your cameras on while you're talking. But other than that, if we all have our cameras off, it will help with the bandwidth. And yeah, for those that are just joining, we're just asking for people to share their names, organizations, and what part of the country they're dialing in from. And if you want to tweet, you're welcome to tweet. I don't think we have anything confidential particularly today. So yeah, do tweet, and the hashtag is hashtag Antibiotic Guardian. Okay, so we now have more than 50 people who have joined us. I think we'll get started. So Aoife, I'm going to hand over to you briefly to do the initial part, except you want me to get started straight away. Donna is saying from cold and wet in Gloucestershire. And Louise from Oxford, chair of the subgroup. Aoife, did you want me to get started, or did you want to go? You might be on mute, Aoife.
Sorry, as I was on presenting, it wouldn't let me unmute.
Oh, okay. So you can present back now and stay off mute, and then I'll get started, and then you start off, and then we'll hand back to each other.
So yes, my name's Aoife. I'm the clinical fellow working in PHE. So I'm a pharmacist by background, having worked in secondary care. And the workshop came about when considering how things will work in COVID and what a big change it is for everyone's practice and how it will impact on their World Antibiotic Awareness Week this year. So yes, that's where the idea for this workshop came about, and just an opportunity to share resources and really give you access to things. So I think sometimes working in clinical practice, you're very siloed from what you see and you don't always know what's out there. So yes, Diane.
Thank you. So welcome again, everybody. My name, if you go to the next slide, please. My name is Diane Ashiro-Dokwe. I'm the lead pharmacist for the HCN AMR division at Public Health England. I'm also the national lead for the World Antibiotic Awareness Week and European Antibiotic Awareness Day activities for England. I chair the planning group, which includes all the devolved administrations as well. Next slide, please, Aoife. So whilst we're waiting for the slides to come up, I just encourage you to share your name, organisation, and what part of the country you're dialing in for. And it's great to have 86 people on the line already. Okay, next one, please, Aoife. Thank you.
Sorry,
it's quite slow.
It's saying it's sharing.
No, we share. We can see it. We just need you to click down to the next slide.
I've moved slides. It just hasn't moved with me. So I'm just going to make sure it's going on to right place, and I'm just going to reload it again. And it's showing this time with the correct slides.
It's thinking. Okay, yeah, we've got the correct slides. So welcome, Minnie from Leicester CCG. Next slide, please.
I've already moved slides. It's not
okay.
Showing. Jordan, can you do me a favor and can you share the slides on your page? Just I don't know if it's the internet here. It's not moving the slide forward.
Hi, Emma. Welcome. Emma from Northwest. So I'm reading them as they pop up, so not all the full details are showing up. And we've got Liz from West Hampshire CCG as well.
Hi, it's Stephen Stewartson. Just to let you know, there are some arrows right at the top of the screen, and I can move pages that way.
Is it showing the correct slide at the moment?
It's showing World Antibiotic Awareness. It's showing the WHO slide at the moment.
Yes.
Yeah, you're showing those now. Yeah.
Okay, great. Next one. Thank you very much for that.
Sorry about that.
Okay, so earlier, so I'll start again. So I'm Diana Ashiro-Dokwe. I'm the lead pharmacist, as I said, and the purpose of today is really to take you through the considerations that you may want to think about as you plan for World Antibiotic Awareness Week. And I've been using the World Antibiotic Awareness Week, but this year, WHO have made a decision to change it to World Antimicrobial Awareness Week, which does make sense because we talk about antimicrobial resistance, we talk about antimicrobial stewardship. But for those of us that have been around for long enough, we know that WAAW came about because of EAAD, which started about 12 years ago, so European Antibiotic Awareness Day. So it's now from this year called World Antimicrobial Awareness Week. I feel this year is going to be a transition year in the sense that we will use both World Antibiotic Awareness Week and World Antimicrobial Awareness Week, and so that's fine. But the aim is to increase awareness of global antimicrobial resistance and to encourage best practices amongst the general public, healthcare workers and policymakers. In the UK particularly, though, we go beyond just raising awareness to increasing engagement and also a behaviour change approach. Next slide, please, Aoife. Thank you. By the end of this workshop, we hope that you will be able to list or be aware of the national resources and toolkits that are available for you to use in your local campaigns. We have done this for the last 10 years, at the minimum, which is the longer length of time I've been in this role and supporting or leading this work package. And the idea is to try and reduce duplication of efforts. So we have resources that are available for you to use, but often we find that colleagues also develop their own resources, and this is absolutely fine as well. We suspect that this year, though, there will be even more challenges to being able to develop local resources. Also that you will have developed a draft action plan for your activities, and that's what the breakout room is really there for. Just, to ask, I'm hoping that you've all started to complete the action plan that Aoife sent as part of the planning for this meeting. And we will share, you will have opportunities to listen to various examples throughout this. So you'll hear from eBug team, you'll hear from Target team, you'll hear from Buckingham team, who have focused on children in particular, and you'll hear from Louise as well, who has led a subgroup, which is part of the National Planning Group, to develop some digital resources, very much taking into consideration what is practicable in local settings at this challenging time that we face ourselves. Next slide, please, Aoife. So the agenda for today, that was already sent out, so I don't plan to to focus on this slide, other than to say that we will go through this agenda as quickly as we can, and we will have the breakout rooms, and then we'll come back together to get feedback from the breakout rooms, and also to consider the action planning and next steps. Please do engage in the breakout rooms, do share your experiences, do share your challenges and barriers, and the facilitators will be there to support you through that. Next slide, please, Aoife. So with the National Planning Group that I've been mentioning so far, each year we meet at least once or twice. Sometime in the earlier years, we met 3 or 4 times, but in the last few years, we've met once or twice, and the National Planning Group sets the direction. We go to them with a plan, and they agree the plan, and then we go to work and provide the resources and the next steps. This year, and as you can see there, it's very much a multi-professional and multi-organization group, including the Veterinary Medicines Directorate, DEFRA, VMD, apologies for the error there. What the planning group does, what we've agreed this year, is that we will focus on healthcare workers rather than members of the public, as we usually do, because the COVID messages are really are quite key, and we need to avoid continuous messaging and multiple messages. So the focus this year is around healthcare workers, and you will see that all through as we share the plans for this year. As with previous years, we'll have a toolkit which will be hosted on the .gov. Next slide, please, Aoife. So yeah, so taking into account the challenges of the ongoing COVID-19 pandemic, we have a scaled back approach to World Antibiotic Awareness Week, and we recommend it, and we know that that's what will happen. And we're taking this into account in the updated toolkit, and also in the sort of resources that we will provide. However, the resources from last year and the toolkit from last year are still valid, they're still in date, and you're welcome to use them as you wish to. Next slide, please. So, I mean, we're going to start off with some key messages, and really they're very brief key messages around the importance of following current NICE guidelines to determine if pneumonia has a COVID-19 or bacterial cause, the importance of treating coughs, fever and breathlessness related to COVID in light with new clinical guidelines, not antibiotics, and also the importance of explaining to patients that antibiotics do not prevent or treat COVID-19. As we developed the resources for this, we were using the healthcare workers survey that we led on across the whole of Europe, and looking at the UK data as well. Next slide, please. So there are several points on this list, and these are some of the suggested actions, but you'll see that they're actually quite simple actions in the fact, and most of them are digital based information to take into account the importance of social distancing. So I assume that this year there will be no stands for people to come to, but there should be other ways in which we can engage with our other colleagues and with other members and with other relevant colleagues. So one is the global Twitter storm, which will happen on the 18th of November. The images and messages we will make available in an app box which is similar to Dropbox, but a version that NHS organizations allow so that you can make use of those. We are suggesting that people record and share short video pledge, a short pledge video to affirm the organization or your individual commitment to tackling AMR. There are digital resources available, which include Twitter polls, images, and also some exciting ways of sharing messages. I'll let Louise share that with you. I'm not going to focus on that at all. And also that we previous year, please do register your activities. It's more important even this year for us to show that commitment to raising awareness, and it takes less than 2 minutes. You can even do that right now if you know what you plan to do, and then you get a certificate which you print out and you can display. You can choose the Antibiotic Guardian Pledge and encourage colleagues and family members to do the same. It is still valid. People can re-pledge again this year. Maybe that's an opportunity for people to take further action this year. We will have a recording for this event available, this workshop, and so you can encourage other colleagues to view the recording. And also, as I mentioned, the toolkit from 2019 is still valid, and there are lots of resources in there that you may wish to use. Next slide, please. So there are some other, the Target Antibiotics Toolkit, the Start Smart Then Focus Toolkit, and the ARC Antibiotic Review Kit websites are all resources that you may want to consider and see what aspects of them may be useful. Obviously, I've also mentioned the importance of implementing NICE guidance earlier. You can engage with training resources. There are several available through HEE's website, e-learning for health, and there are also available resources through Target Toolkit and other MOOCs as well, for example, opportunities to engage with training resources. One thing to highlight is that the Keep Antibiotics work in media campaign, so will not run on TV or radio this year. However, the resources are available and free for you to download and use in local campaigns. Again, you'll need to use them digitally because I don't believe they'll be posting out any resources from that campaign this year. As you know, they're focusing on the COVID public messages at the moment. Next slide, please. So previous years, we've always had letters that went to chief executives from the chief professional officers and PHE. This year, we're not quite sure how the letters will work because there's a scaled back approach to communications. But what will happen is that they may likely go into the bulletin with a link to where the resources sit on .gov. So we are working through that process at the moment, but with whichever way there is, this is to let you know that World Antibiotic Awareness Week is still an opportunity for us to continue to focus on the importance of tackling AMR. And that even in spite of the COVID pandemic, we still need to ensure that stewardship principles are being followed as much as possible. I know that it's really challenging times, but there are still some ways in which we can engage with that. Next slide, please, Aoife. So I've talked about the Keep Antibiotics working, but those resources and tools are all there for you to still engage with and use. I'm going to hand over to Aoife now, who will talk you through the various resources. Some of them will be those that I've mentioned already, but she will be showing you more information about where they are and how to access them. And then you'll hear from the Target team and the eBug team, and also from Louise, who is the chair of the subgroup, as well as Claire Brandish as well. So I'll just hand over to Aoife now, and I'll go on mute, and I will see you all in the breakout room.
I've just noticed a comment asking if there is the slides are available. We will send them out. In the slides, there's a lot of links embedded, so people actually can access the resources that are available. So the first thing I'm going to focus on is the Antibiotic Guardian Sharedaring and Awards page. So the Antibiotic Guardian Awards, the shortlisting is being formally announced publicly this week, and the event will be on Thursday, 26th November. We've got awards across 12 categories, and all previous shortlisted entries are available online. So they're available for people to see, to view, and actually see good practice, and actually take the opportunity to learn from what other projects have happened and what people have done. In the shared learning, it also includes information on a brief overview, example of outcomes, and also future developments from each project. So it's a great resource to actually have a look at and use for even inspiration or ideas of what other people have done and hopefully what you can try and do in the future. Sometimes I think it's important not to remake the wheel and learn from what others have done before. I would encourage everyone, once they do a project, to share it, to publish it. We'll be taking entries again for the Antibiotic Guardian Shared Learning Awards next year. There's other suitable conferences, including the Clinical Pharmacy Congress. There's the HisFiz conference as well. So really take the opportunities to share your good practice and work. As Diane mentioned, we encourage everyone to register organizations' activities on the Antibiotic Guardian website. If you register your organization's activities, they do get a certificate which they can use and display. It's quite quick, it doesn't take long, and the link is just there on the page as well. We really would encourage it and just to help get organizations engaged. One of the things we're doing this year is we're encouraging national organizations to pledge their commitment to continue and actively support the fight against antibiotic resistance. So we're asking them to create their own video pledges. They can create their own pledge, or they can. We have example pledges for them to use as well. We would encourage organizations at local level to get engaged with this as well. So, can a senior leader in your organization produce a video to show their commitment? And that can be shared on the organization's social media, staff newsletters. It's just a way of getting people engaged and aware of what's happening, and that it shows that the boards, the trusts, the head of organization is engaged at a higher level to really encourage people to get involved. As Diane mentioned, we're very much encouraging the use of the antibiotic review kit. This is a clinical study that was originally piloted in the Royal Sussex Hospital in Brighton, and it's actually got a full peer review. It's been published as a peer review study and shows evidence of how to improve engagement with stewardship and improve with evidence of improvement. If you want to know more about it, there is a link on the ARC study website if you want to look more into it for your organization, and also there is training on it on e-learning for health, which anyone who works in the health service can access this training and actually have a look at it and see what it's like, and actually use that to help introduce it into their own organization. I'm a big believer in thinking about what's out there and not remaking them. So there's on our Antibiotic website, there's quizzes and crosswords that have been produced for a variety of different healthcare professional groups. One thing you can do this year, you can't give them out in person, but you could also have a virtual competition, share them via trust newsletter. Any way you can use to share a message to get people involved. Other things is you could have a group training or group meeting using Teams to get people involved and use them as more of either more serious or more fun or something to get people engaged with what you're doing and making use of what's there. To date, there's already been a lot of images, a lot of resources produced to support teams in their work. So what I've linked is a list from one of our app boxes that we use, which has a list of templates and different things you can use in your branding that you can use to develop your own activities and make use of. They're all there and they're all free for anyone to use and available. There's also other things. You can get Antibiotic Guardian logo on posters, on images, on t-shirts, whatever you want to use, it is available and the logo can be used. And on the link on the link to Gov UK website, there's a link to where you can get that and how to use it. Here I've just put just a list of resources just to introduce you what is available so you can use it for yourself, see what's there. First thing on the list is the key messages. These are updated every year for World Antibiotic Awareness Week and are shared on the same webpage. So they will always be there for you to use. A toolkit, as Diane has already previously mentioned, is in their list of resources. A link to where you can get posters and leaflets. There's also a dental toolkit if anyone's engaging dental practice. This year, the dental toolkit also added a pain management advice. This is support dental teams during COVID. And also there's also a list of a publication document around antimicrobial and prescribing stewardship competencies. So if you've got new prescribers in your department and you want to think some more about, or new pharmacist independent prescribers, new nurse independent prescribers, if you want to think about how they think about stewardship and what competencies you want them to complete it, there is a published document on it that you can use to inform your training and education. The ECDC also has resources, including resources on how to plan a campaign and also resources for healthcare workers. The healthcare workers also links to the healthcare workers survey, which was led by PHE, and the data for the European Union has been published and is also available on that website. And that's me done. I'm now going to move on to Donna. If there's any questions coming in, just email the SBAR email account, and I will get back to you via that, because I know we're quite tight on time today.
Hi, Aoife, do you want me to request control or do you want to change the slides?
I can change slides for you.
Okay, fabulous. Hi, I'm Donna Leckie. I'm the Target Antibiotic Programme Manager, and I want to give you a very quick whistle-stop tour of the Target Toolkit and highlight to you the resources we've got available that you can use in your World Antibiotic Awareness Day campaigns. And also show you what we've done in the past so that hopefully you can get some inspiration from that. For those of you who don't know, TARGET stands for Treat Antibiotics Responsibly, Guidance, Education and Tools. It's a suite of resources and a collaboration between Public Health England and the RCGP. But at this point I want to emphasise that although the toolkit sits on the RCGP website, it is completely freely available to anyone and everyone. You do not need to be a member of the RCGP to access the toolkit. Sorry, next slide, please, Aoife. So to go through the resources very quickly, we have a range of training resources. We've got a series of e-modules that are available on the Target website that you can access that have been developed in collaboration with the RCGP. We also have a workshop presentation. This is what we call our core presentation, and this is to be used with in a whole practice approach in the primary care setting. And at the end of this hour-long session, prescribers and the practice should go away with a forward action plan. We've got a webinar series that we've developed in collaboration with BSAC, and you can see the images of that below, and it covers all of these topics. We also have a Future Learn course which runs every 9 weeks, which is freely available on Future Learn, and we have a series of podcasts which are clinicians talking about various issues that they've got around prescribing and antibiotics. One of them is on urinary tract infections. Next slide, please, Aoife. Next slide, please. One of our more popular resources are the patient information leaflets. These leaflets have been designed with patients and with with prescribers, so GPs and nurses. They have been designed to be used in consultation with the patient. The leaflets cover similar areas. So the two we've got at the minute is respiratory tract infection and urinary tract infection. They cover recommended outcomes, so are antibiotics required or not. They also cover self-care advice and safety netting advice, as well as for the UTI 1 options to help prevent a UTI. All of these leaflets are completely evidence-based and freely available on the website. Fully aware at the minute that during the virtual consultation that you cannot share these leaflets with someone face-to-face and have a discussion, but we are working with organisations to make these leaflets available to be able to text to patients, so that you can still have that conversation with patients on the phone, and that should be ready, up and running by World Antibiotic Awareness Week. Next slide, please. We have a series of audit toolkits available as well, and these audits are to audit compliance with NICE and PHE prescribing guidance. And the first 4 here in black are audits that are currently completely available on the website and can be used. The ones in grey are ones that we're either updating or, in the case of the 4Cs, developing, and these should be ready by World Antibiotic Awareness Week as well. Yes, we are working with Accurex Graham to make the leaflets available. Next slide, please. We also have links to antibiotic and diagnostic quick reference tools on the website as well. these look very complicated from a patient point of view, but again, we're working with Accurix to embed this diagnostic flowchart into questionnaires that can be sent to patients, so that GPs will have the answer to all of these questions, or a lot of these questions, before they even have the consultation with the patient. So that can help guide their prescribing as well. And again, these are fully referenced and NICE endorsed. We have resources for clinical waiting areas, but I don't want to waste time on that at the minute because there's very little patients in the clinical waiting area. Next slide, please. Next slide, please. And we also have self-assessment checklists. This is for prescribers to reflect on their own prescribing. Reflection is extremely important, especially now during COVID. This particular one is on UTIs, but we've also got one on prescribing in general. It's something that a prescriber can do in their own time, and it's really for their own information. Next slide, please. So next thing, so that's a whistle-stop tour of the resources we've got. So what did we do last year for World Antibiotic Awareness Week? Before you do any campaign, you really want to think about what your objectives are. What is the point in investing in this resource or investing in World Antibiotic Awareness Week? And from our point of view, it was to extend the reach of the target toolkit by raising awareness of the resources and AMR amongst GPs and practice teams. We also wanted to support GPs and practice teams to reduce inappropriate antibiotic prescribing, and to inspire more GPs to reduce antibiotic prescribing and promote continuous professional development. Next slide, please. So how we went about that, we did a three-pronged approach. Sorry, next slide, please, Aoife. We did a three-pronged approach, and rather than leave everything to World Antibiotic Awareness Week, we decided to do it in a leading way into World Antibiotic Awareness Week. So it was 6 weeks. So we had a social media campaign. So this was a collaborative Twitter storm, apparently, is the phrase. I didn't know that at the time. So from the target Twitter account, we every week put out some advice with links to target resources that people could use. So the first one, for example, was self-assessment checklists. And we had some evidence in there about why these are important. And at the end of the 6 weeks on World Antibiotic Awareness Week, these all came together in one big poster that GPs could print out or use as screensavers. At the same time, from the RCGP Twitter account and Facebook accounts, they had these types of infographics that they tweeted about. And it helped facilitate the conversation. It got people talking on Twitter about antibiotics and antibiotic resistance and prescribing. Alongside this, not everybody is on social media, so alongside this we really wanted to put some literature out there, and we covered 5 key areas, and we got experts in the field to write an article for the clinical news that was sent out as well alongside these social media campaigns. And then finally, we launched the Target Antimicrobial Stewardship Train the Trainer programme. This was to develop a team of Target accredited trainers across the UK. We had lots of people from CCGs and pharmacists signed up to this. Unfortunately, we had 8 Train the Trainer workshops planned, but because of COVID, the last 4 were cancelled. But from the 4 workshops, the training was cascaded onto 11 workshops delivered by you, the trainer. So those who came to the Train the Trainer further delivered 11 workshops directly to GP practices. And that was over 180 individuals got trained using this method. It was quite successful. Next slide, please. So this year for World Antibiotic Awareness Week, our objectives are very similar to last year, but what we really want to do is launch the new and updated target resources. So I talked about the leaflets that we had. This year we've got a self-care leaflet, so how people can look after themselves if they're feeling unwell. This is for general illnesses, and we do mention COVID in there. We'll have the audits that we launch, but we'll also be launching a webinar on prescribing during COVID, and that will cover delayed prescribing, which a lot of GPs have asked us about, supporting their delayed prescribing. We're going to roll out a Twitter campaign again, focusing on those top tips from during virtual consultations. We'll have the patient information leaflets available in digital format that can be texted, etc. And we will launch and roll out virtual Target Train the Trainer as well. So we've changed the training, so we're going to do it virtually, and we'll be rolling out 1 a month over the next 6 months, hopefully, providing we can get the consultant to deliver the training. And the launch dates for that will be advertised very soon. Thank you.
On to me. Shall I just take over now?
That'd be brilliant, Rosie. Thank you.
Great, no problem. Hi, so I'm Rosie. I'm eBug project manager. So similar to Donna, I'll give you a whistle-stop tour of eBug and make some suggestions that you may want to implement as part of your World Antibiotic Awareness Week planning. Next slide, please, Eva. So for those that don't know, eBug is PHE's health education resource. It's designed to teach children and young people, so this is the 4 to 18-year-old age range, about microbes, the spread, treatment and prevention of infection and antibiotic resistance. So not just part of World Antibiotic Awareness Week, it's very relevant now with COVID as well. All materials are available to access and download for free from the eBug website, so you've got a link there. And a bit of an overview of some of these resources. They currently consist of age-appropriate materials such as lesson plans, interactive activities, debate kits, games, and videos. So there's a whole breadth of things there. Next slide, please, Aoife. So eBug is evidence-based and links into national strategies. I won't go into details, but some of them include the government's 5-year national action plan, linked in with national curriculum, and is recommended in the Department for Education COVID-19 guidance for education and childcare settings during COVID-19. Next slide, please. Just a quick overview of some of the topics that we've got. I said that, we've got a whole range of resources appropriate for teaching on microbes, spread of infection, prevention of infection and treatment. And these are appropriate for different key stages as well. So I won't go into these in detail, but just to show you the breadth of resources that are there for you. Next slide, please. What I'll go into now is some suggestions of things that you might want to either implement yourself over World Antibiotic Awareness Week or recommendations for plans within your organisation. So the first one, there's 6 recommendations. So the first is to complete free e-learning to improve your knowledge and confidence to teach children and young people about microbes and how to prevent the spread of infection. These are free. On the website, we currently promote 2. So there's the eBug Health Educator Training, the one on the left here, designed for those teaching children and young people, so the 4 to 18-year-olds, or this one on the right here, which has been made since COVID-19 pandemic. And this is about preventing and managing infections in childcare and preschool, so for the early years setting. Next slide, please. Next slide, please. Great. So the next thing you might want to do, so the first one is about improving your own learning. The second is about designing to increase capacity to train other educators. So this is the train the trainer approach. So you may want to contact eBug about joining a remote train the trainer session to increase capacity to train other educators about key infection, prevention and control topics using the eBug resources. So this workshop might be suitable for local authority, government officials involved in the management of infections and improving antibiotic use within communities. It might be appropriate for leads for healthy schools, children, young people and families, STEM outreach, community groups, or other educational networks. So do contact us if you would like to organise a workshop for your local authority or network. Next slide, please. The third thing you might want to do is to use the eBug lesson plans and activities to teach about hand hygiene, respiratory hygiene and antibiotics in an engaging and age-appropriate way. And if you go on to the next slide, I've just got a couple of images to show some of these activities that might be appropriate. So in the top left, we've got some photos of our respiratory hygiene activities being demonstrated. And this is with a snot gun that shows how far a sneeze spreads and reinforces the key messages about covering coughs and sneezes. Very appropriate at the minute. The top right is about hand hygiene. So you may want to use glitter or UV gel and demonstrate the 6 steps of hand washing, and you can kind of see how well that has gone using the glitter or the UV gel. And then the bottom picture is an activity to demonstrate antibiotic resistance. So you can see here the yellow balloons are bacteria, the red one is an antibiotic resistant bacteria, so they appear the same but are slightly different. The pin at the bottom kind of replicates an antibiotic, which can be used to pop the yellow bacteria, but the red one that's got a little sticker on top of it is resistant, and so the pin will not pop that bacteria. quite a nice way to demonstrate it, which is quite a difficult concept for people to understand sometimes. Next slide, please. Using those activities, you might want to earn badges with our Antibiotic Guardian Youth Programme, and this is something we're going to be promoting as part of World Antibiotic Awareness Week, and there will be a competition for the best poster, song or video submitted during that week. So yeah, that's something to consider. Next slide, please. Number 5, you might want to display hand hygiene or cover coughs and sneezes posters in bathrooms, hand washing stations, classrooms and shared spaces. And then the last one, so I don't know how we've gone from 5 to 7, but number 6, you might want to provide feedback on my Back to School Bubble e-storybook. This is designed to help younger children understand the new COVID-19 protective measures and tackle anxiety about returning to school. And we'd like to collect some feedback on that, please. There is a chance to win a £40 high street voucher if you provide feedback on that too. Then the last slide just summarises this, so I've just put them all together. These are the 6 recommendations that you might want to take on board. The 2 that are highlighted, so number 2 and number 4, are what EBOG are going to be promoting during World Antibiotic Awareness Week, which are those remote train the trainer sessions, and then also the Antibiotic Guardian Youth Programme. All resources are free and can be accessed from the EBOG website, so there's a link there for you too. Thank you very much. On to the next presenter.
Jordan, please, can you start this? Thank you.
Yeah, absolutely. So take you guys through Antibiotic Guardian Schools Ambassadors very quickly. So if you go to the next slide, please, Aoife. So in 2019, Ambassadors was piloted as a campaign for the first time. It's really to do with getting healthcare professionals into schools and community groups in order to engage with key learning on AMR. So this was advertised, and to those that signed up, a toolkit of ideas and lesson plans was provided, and there was a webinar as well. A newsletter item was provided to the ambassadors, as well as template emails to engage with their local schools. Next slide, please. So as you can see, also the schools were engaged, were encouraged to register, and we got really good engagement across the whole of the UK. They were asked which sorts of activities they preferred, and you can see that they were really keen to engage with the learning, but also with the newsletter items as well, with schools being busy with assemblies and lessons. Sometimes this is a good way to engage. 27 schools registered in 2019. Next slide, please, Aoife. We had 76 individuals sign up to be ambassadors. Of those, 46 were from PHE, 30 were outside of PHE, and 45 said that they would be comfortable delivering a face-to-face classroom activity. We asked for a post-pilot survey. 34 of the 76 engaged with this, and 24 of those indicated that they gave one of the sessions or provided a newsletter to their schools. And as you can see, primary schools were the most popular ambassadors to engage with. Next slide, please, Aoife. The 2019 pilots engaged approximately 1,900 children with either the newsletters or teaching sessions. That's a really great result. Of the 24 ambassadors that responded, they all either agreed or strongly agreed that the children understood the concepts covered in the presentations and that they'd be happy to do this again and recommend to colleagues. They also engaged children in surveys with a show of hands, and there were really good results in terms of the children indicating that they had fun and that they'd be happy to engage with other people, sharing this learning with friends and family. Next slide, please, Aoife. So here are just a few photos of some of the really great sessions that we had back from ambassadors. You can see that children engage with posters, the horrible hands, and things like that, where you can see how the spread of infection happens in a fun and engaging way. A little like what Rosie was talking about with the EBUG materials, and we rely heavily on the EBUG materials. Next slide, please, Eva. So this is just to show you some of the material from the 2019 toolkit. So we had pledge templates that were appropriate for school children. We had some of the amazing eBug lesson plans in there, debate kits. We had crosswords, quizzes and game ideas. And so all of those were in the toolkit provided to the ambassadors to give in 2019. Next slide, please, Eva. So 2020, obviously, there are some barriers to doing a lot of what we did in 2019. So we presented this to the World Antibiotic Awareness Week National Planning Group, and it was agreed that in 2020, the focus of the campaign would be on providing an updated version of the newsletter item to overcome the barriers in accessing schools and complying with government advice on distancing in schools. So this newsletter item has been adapted to include information on COVID-19, self-care, hand hygiene, and links to updated eBug materials. There is an updated ambassadors toolkit that takes all of this into consideration and provides some distance friendly activities, although we're not pushing this in 2020. The focus will be on the newsletter item. This updated toolkit is available on request, so please, if you'd like to use this for inspiration, please do get in touch at the SBAR inbox. Next slide, please, Eva. So the steps that we'd really like people to engage with in 2020 is to register your interest to be part of the second pilot, to contact schools to see if you'd be able to supply the newsletter and how and where that would be circulated, to get schools to register as well as participating and being interested to circulate that newsletter item, and to visit the Antibiotic Guardian shared learning page. There are lots of really great ideas on projects that schools can engage with in terms of children and family. So I think that's everything from me.
So Claire now is going to share some of her amazing work in Buckinghamshire. Claire, are you now available?
Hi, Aoife, thank you. Just to reiterate that a lot of this work is based on the ideas from other areas that have initiated this work. So certainly Baines and Birmingham CCG have been a massive influence on this. And as Aoife said, we're not reinventing the wheel. So in 2017, we emailed all the schools in Buckinghamshire. There are about 300, and I hand inputted these into a long email and asked the schools to get involved in a competition to raise awareness of AMR. So initially this was just a poster competition, and then over the next couple of years this project evolved. So the schools were very keen to get us to go into the schools, and we undertook a couple of assemblies which involved using the eBug resources, with the balloons in particular, so all the very visual stuff, and the hand gel as well. So we gave an assembly, and then they were asked to create use other resources to raise awareness. So, you know, a dance or a rap or a poem or anything like that. And these were judged every year by one of the consultant microbiologists. And then we held an award ceremony at the hospital just to make it a little bit more special for the participants, and there were prizes given to the best person who created a poster or a dance or a rap. And then last year we were involved in the Commonwealth Partnerships for Antimicrobial Stewardship scheme with Nottingham Trent University and Makerere University in Uganda. And this really took it to another level, because during the time that we spent scoping out there and delivering workshops to healthcare professionals, we asked to go to 2 primary schools and deliver very similar sort of workshop activities with them, focusing on hand hygiene, so good infection prevention control, and also raising awareness about not misusing antibiotics or requesting them when it's not necessary, and certainly in Uganda not buying alternative antibiotics. So the competition last year looked at entries from Buckinghamshire schools, and then also entries from Ugandan schools, and we twinned 2 primary schools with each other, and then we shared all those entries. So on the screen, this is the first year that we ran it, and this was the second year. So we did have a message in a bottle where people put their pledges in, and that was circulated throughout the school playground. Obviously, that's a bit tricky this year. And then the next slide just sort of shows some of the work that we did during the twinning exercise, and we asked the local radio stations for help with this. And the councils as well were really instrumental in actually getting the messages to the schools and getting the schools involved. So you'll find that some schools within the area are very engaged and very enthusiastic, and they will want to participate every year. So we'll have to see what we can do this year a bit more remotely. Thanks, Aoife.
Thanks, Claire. We're now going to have Louise. So this year there was a subgroup of the National Planning Group set up, which Louise has chaired, looking at developing digital resources for World Antibiotic Awareness Week.
Hey, thank you, Aoife. Thank you, everyone. So I'm going to take some time just to share with you, as Aoife was explaining, some digital resources that we've developed for trusts to be able to use for Antibiotic Awareness Day, understanding the challenges that we're all seeing with our COVID-19 pandemic. There's many members of the subgroup on the call today, and so as you can see, and some of them have already spoken. And the idea is that these messages can be used by both acute trusts and also primary care and the community health teams as well. And as I say, as Diane said at the start, it's healthcare focused. Hopefully you can see from the membership that we had people from a whole array of different areas, and also including things like paediatrics, etc. And thank you, Aoife. So when I show you the next lot of materials, they were based around 5 key themes. So the empiric prescribing, course length, start smart then focus, patient safety and resistance. So before we just go on to the actual sort of campaign, but what I wanted to try to say is that we've gone for a very image-based campaign, and the idea is they say that a picture's worth 1,000 words, and so we were hoping that by sharing the images with you in a few moments that these can then be shared through social media, through WhatsApp, whether your trust has got a Facebook page, Instagram, whatever. So Aoife, next page please. So the focus is around sticky notes. Now, each of these sticky notes will have key messages related to those 5 themes that we've already discussed. We've got sticky notes in different colours. We've also got them in different fonts and presentations to help people with sort of different reading abilities, remembering that these are all messages focused at healthcare professionals. And many of the messages have come about from the healthcare workers survey, etc. There's also very set term hashtags as well, which will be involved in the images. So these images will be available before Antibiotic Awareness Day or World Antibiotic Awareness Week, and through the app box, which we'll talk about in a minute. And you can either use these, whether you use yellow, blue, combination of the two, or hopefully you will be inspired to think about messages that you can use for your own organisation, bearing in mind that we've still got the same hashtags. But it might be that you want to then develop your own sticky notes, can't use post-it notes, trademark, and therefore you might want to put your own trust's hashtag on, or etc. So although we've only put 2 images on here, there are many which will be available in the app box before the day. Now, the main focus would be allowing you to do the sticky notes, but as Aoife's moved on, thank you, Aoife, the other thing we've got are Twitter polls. So the Twitter polls are going to be hosted out of the UK CPA Pharmacy Infection Network Twitter page, but there's nothing to stop an organisation actually using the same materials to run the Twitter polls outside of their comms team. Now, for each of the Twitter polls, there are 5, so you will get a Twitter poll each day, and then the answer will be provided the next day. And within the answer, we will have images and also links. So for example, if something refers to the NICE guidance, then there'll be NICE guidance hyperlinks. And the idea is it's a way of actually providing the answer. So all of these Twitter polls have been developed by clinicians throughout acute trusts, primary care, etc. So hopefully using a wealth of experience to help you come up with polls that are useful for your different clinical teams. So, and then if we move on to the next page, the other thing we have now, these are called additional resources. So some hospitals are working in the climate of they're wanting to thank their staff for X, Y, or Z that has happened over the time of the pandemic. So we also have some set templates for thank you notes or thank you letters, however you want to phrase it. And again, there are key messages based around those 5 themes that we talked about, and they are both. There are some that are primary care focused and some that are acute care focused. As you can see, thank you for nice prescribing, thank you for targeting. And the idea of these is that if that's something that your trust were wanting to promote through thank you, potentially you could develop your own thank you messages using these as inspiration and then adapt them using your own organisation hashtags, etc. So all of these resources, thank you, Aoife, will be available before the day through AppBox. And we're hoping that you'll either use those through social media, through WhatsApp or whatever, or potentially be inspired to develop your own resources. Thank you very much.
So everyone, in your emails, the ones are sent out yesterday, there should be a link for everyone's breakout room. And in a breakout room, we're focusing on the following questions. So thinking about what outcome and aim you have from activities, what are the major barriers, what have you learned from previous projects or projects shared today, and how will you share your work afterwards or evaluate the outcomes. I've noticed we are 10 minutes late, so what we'll do is we'll run the breakout room from till 1 o'clock instead, and we'll account for the time afterwards. And if everyone can now leave this meeting and join the breakout room, that would be perfect. Thank you.
Hi everyone, welcome back. I think we're just waiting for others to join us back in. I think, okay, no, I can see Aoife's here now, so most of the groups should be all coming back in now. Whilst we're waiting, you can just type into the chat box some of your key learning points so far, some of your surprising discoveries or new ideas that you haven't thought about before. Please type it into the chat box whilst we're waiting for others to join us back in.
Oh, we'll go back to the right. Sorry, Diane, I missed what you said. Did you want us to type something in?
Yeah, just type in aha moments, something interesting, something new you didn't know about, that you found out during the breakout session. Different languages, voice messages in different languages. Ooh, that sounds interesting. QR code is way forward. Okay. So I'm trying to find information about voice messages in different languages. Raki had a, oh, okay. Thank you, Claire, for sharing that. Accurate tools sounds great. Okay, thank you, Lovat. Let's see what else. So please share new things you learned, new ideas. Whilst we just wait. Aoife, whenever you're ready, you can take it away. I'm just holding the fort. So somebody didn't get to share a link in the breakout room, but they've shared it into that. Approval of comms by committees, and that's good. Yeah. Yes. Well, it's been a constant challenge, but the resources available are still the same. We haven't really, we've got tutor polls this year. But for most years, we tend to use the same sort of resources again. But yes, we will get through the, we should have the final toolkit published ASAP. Elizabeth says, I'm working with NHSI comms to try and promote the sticky note resources and Twitter poll resources. Yes, thank you. eBug resources look helpful. Excellent. Let's see what else people are sharing. Want new resources because old resources are not having an impact. I would say yes, that's good, but also we sometimes haven't implemented enough and we keep developing new things. Great engagement with schools by Claire Brandish. Thank you, Kathy. Dates for virtual train the trainer sessions will be helpful. So I think that's for you, Donna.
Donna, if you share that with me, I can email it out to everyone.
Yeah, thank you.
Or I think you want somebody to share. I've got everyone's email, so I can send out a group email of any resource or links people would like.
Really keen to plan World 2021 focus on antibiotic cafe model and start discussions at RPS already. That's fine, Elizabeth. That sounds good. Okay, Aoife, we've got 77 people back in, I think.
Yes. Or 67?
Oh, 67. Sorry, I made that up then. I think that's something from me. I was popping into the breakout room, so thank you for those who admitted me in, or I joined your call. There was a question about engaging with schools and needing to get requesting information, and I was just highlighting that there is a school's website where if schools are having activities for World Antibiotic Awareness Week, there is a page where they can just provide that information, and that they include their postcode within that, and we can easily just we will share the information as to what schools have participated. So that's for those who are engaging with schools and not wanting to have data burden or data collection burden. There is a registration schools, similar to how we have organizations registration and individual pledges. There is also a schools version. Okay, right.
Different facilitators to pull in. So I'm going to start with Ella. Ella, are you on the line? Can you feedback from?
Hi, Aoife. Yes, I can. We had some great discussions, so I'll just very quickly go through what we talked about. So in terms of the aims and outcomes of activities, the two sort of main aims people were talking about was educating children and linking with schools, so building on Claire's presentation. We talked about how people had wanted to focus on hand hygiene previously as that message to schools, but this is being communicated quite a lot via COVID messaging, so sort of shifting the focus instead, and perhaps changing it more to antibiotic use. So yeah, educating children. Our second sort of aim was raising awareness among staff internally, so encouraging staff to pledge to become an antibiotic guardian, dropping into sort of departmental meetings and sending out emails encouraging people to pledge. We had a great example about targeting specific problem areas within hospitals. So what they wanted to do here was sort of a mini conference with speakers to target specific areas, one of which was awareness in junior doctors is really high, but in senior staff, it can be a bit more difficult. So focusing on raising awareness within senior staff, working with oncology colleagues to reduce the use of carbapenems, really specific targeted ideas. So that was great. In terms of barriers, raising awareness virtually was highlighted as a bit of a concern, potential shortage of staff, the impact of COVID-19 on antimicrobial stewardship activities and progress so far anyway, dilution of the messaging due to COVID and the sheer volume of information people are receiving at the moment, that was a potential risk. And another, I suppose not barrier to the activities, but was how to actually measure the impact virtually. In terms of what was learned, we had a lot of great feedback about Claire's presentation, EBUG being a really interesting idea and a great technique for engaging with children from an early age. It was really useful to recap the target resources, and the Twitter polls came up quite a lot. And then finally, just with how they'll share work afterwards and evaluate outcomes, counting the number of people engaged with was one, using school, sort of tracking the number of schools that pledged by using their postcode, which Diane helpfully helped us with, and then looking at the feedback of responses from Twitter polls.
Can I just talk about, so we're very brief, there was a comment there about the barriers and too much information for the public at the moment. That is part of why, as the National Planning Group, we're not focusing on the public, and that is part of why Keep Antibiotics Working. It's not the only reason, but it's part of why Keep Antibiotics Working campaign is not going to be in the media this year. So we do need to be aware of that. I do think that schools may or may not agree, but I think if you're going to contact schools, it's going to be important that it's done and shared in the context of COVID. And that's what we've built into the newsletter item that we've developed and the template email. So if anyone's wanting to link up with schools, do contact us via SBAR and we can share that with you, so that the aim, as we say, is to reduce duplication of efforts and basically so that you can focus on other parts of the work. And these tools or these resources or information have gone through several individuals and several committees. So for those who are thinking about contacting schools, do share with us and we can provide you with some information and some support.
And can I now move on to Jordan, please?
Yes, off mute now. So we had a really great discussion. Similar to what Aoife was saying, the barriers around this year are going to be about distancing, and a lot of our speakers before would go around the wards and be able to hand things out. We touched quite a lot on the importance of bribery before, so having things branded with Antibiotic Guardian, Keep Antibiotics Working, and they were really successful before, and the barriers to doing that this year A lot of people still had leftover stock though, so they could use it if they find ways to overcome the distancing barrier. We spoke about how it was really important to get executive buy-in as well. So a bit like what you were talking about with the videos from organizations with the key executives talking about their commitment to AMR and posting to resources if there's a bit of an executive buy-in to something like the sticky notes, which were really heavily praised in our group. That would be great. And if they could, if the exec could pick a message, a key message for each day and post via their preferred platform in their institution, that would be great. Linking with EMIS as well, or whatever the trust or organization uses to sort of distribute that messaging, that would be really great. Again, we touched on that overload of comms in 2020 around COVID and everything else. So it was the short, snappy nature of the sticky notes, which were really liked by everybody in our group. We touched on the fact that people could even use these physically and write their own and pop them on people's computers or somewhere for them to see during the day. So there are lots of different directions that can be taken, which was really encouraging to hear. And also a really encouraging thing as well was people, even though distancing will be a barrier, we had some ideas of people in areas. I know there was an individual from Jersey where the rates of COVID are lower, and there was still interest in trying to engage schools somehow in AMR learning. And I know another colleague as well was interested to organise distance tours of microbiology labs within trusts, just to get people interested in microbiology and sort of places that are usually a little bit more out of sight, to engage everybody across the trust. One final thing as well was the importance of engaging non-healthcare professionals as well. That's a bit of a barrier. And like Ella said, it was about how we collect information and evaluate our work. There was a really great project called the To Dip or Not to Dip, and that was done through surveys. That was a presentation, and surveys were taken before and after to try to quantify the difference in learning. So I think engaging ways that we can evaluate projects is something that needs to be thought about more. I'll leave it there. Thank you.
Brilliant, Jordan. Thank you. Donna, if you can go next, that'd be brilliant.
Okay, I'm typing this up to send to you as well, Aoife. So okay. Outcomes would be to what outcomes the aim from the activities. Many people said to reduce inappropriate prescribing, particularly broad spectrum, supporting clinicians so the clinicians know what they can and can't do. So, for example, if they've got a photograph of a tonsil and they can't see it very clearly, they're just prescribing. That's the feedback that they're getting. Build on what the public are knowing. It's reported there are less consultations, so there's a feeling that engagement and interest with the public is high, so we really should be doing something more to build on that and keep that momentum going. And one of the comments that was very interesting was that children all now know what viruses are. Utilising the skill mix that we now have based on COVID, so there has been some positives have come out of COVID, so there's an opportunity to use that collaborative work. For example, having the PCN pharmacists on board has been a real asset, so really wanting to build on that relationship. Major barriers, the key major barrier that almost everybody said was approval from comms by committees, and the fact that in the past any resources that have come out have been not come out till October or November time, which is far too late for the CCGs to be able to get approval from comms. So they really need the resources by September. So that's a lesson for us moving forward, Aoife, is that we need to have our toolkits ready way in advance so that the CCGs can get approval to promote them via comms. Also, so much comms is going out on COVID, so messages are getting lost. So we had a bit of a discussion around whether or not the message coming out should be on antimicrobial stewardship or whether the message going out should be around COVID. And the general feeling was lead message should be promote antimicrobial stewardship because GPs are getting fed up with the COVID or they're getting COVID overload, but at the same time having a sub message there saying these resources have been COVID approved. And also many of the resources it's not stated whether they're being updated or not in line with COVID. So some resources may not need to be updated, but there's no message saying that it has been COVID approved. What's needed is signposting with timelines of when things will be ready, guidelines and online consultations, and what's been learned from previous projects or projects shared today. So this was something that people were saying they really want to engage with schools. They loved the EBUG talk, the EBUG resources, but they're wanting to know, it would be useful if we could provide them with, signpost them of who to talk to so that they can engage with schools. And I see some people have put in some really good comments there about contacting local authorities, contacting regional IPC teams, but I think that's something, those guidelines of how to is just as good as providing the resources. So we need to be better at maybe helping with guidelines of how to communicate and who to contact and where. We didn't get to the last question, sorry.
All right, but that's actually really good, especially about how to do stuff. I think that's a really good thought, and actually how we explain ways of engaging. I think it's probably different across the country, but actually how we support that as well is really important to think about. And now Rosie, please.
Sure. So we also had some really great discussions. Some of the activities that were spoken about was about trying to reach non-native English speakers. So Raki spoke about how in her CCG she's got quite a diverse population. So they've identified the 4 most widely spoken languages, and they've recorded messages in those languages that they're going to push out through their different networks. So that's kind of a patient-focused part that they're doing, and they'll be evaluating that as well through those networks. So kind of the reach that gets to, and then also social media campaigns for the healthcare professionals. So evaluating those through the social media means that we've got. Some of the things that people really liked and are going to pick up on are the post-it sticky tools. So those short, snappy messages, people really got on board with. Some of the barriers, nothing new to what others have said. So there's been some confusing messages with COVID and sepsis. So it's about ensuring that all messages have been okayed by the clinical director or similar there. And just the onslaught of information that people are getting. So ensuring that there's targeted and relevant messages that are going out. Other things that people have learned. So assemblies went well last year, but obviously unable to do that this year. They used to visit the ward and have like a spin the question wheel and relevant questions for nurses, doctors or patients, but again, unable to do that this year. Something that we discussed quite a bit was about QR codes. So printing QR codes and displaying those so it takes people directly to, say, patient information leaflets that could be displayed wherever, or handing them out as like a card that has all the information on that's appropriate there if there is any face-to-face contact. Antimicrobial cafe. So it's kind of, we used to be face-to-face, could be something that people do remotely, that you kind of get together and discuss myth busting or discuss some controversial questions, but has been quite helpful for others in the past. And webinar about prescribing remotely, and that's also about supporting winter pressures and COVID as well. One lesson learned was to beg, borrow and steal from others, which is quite a useful one. A question that we did have was about evaluating outcomes. So we spoke about evaluating Twitter polls, and it'd be quite helpful if there was any guidance on how to do that for those that are not as computer savvy. So that'd be quite helpful. And we thought possibly, because some of these Twitter polls have been developed based on healthcare workers survey, whether that is likely to be rerun and whether there'll be any changes based on that. And one last thing, so with the QR codes, there was a question whether you can track how many people have accessed through the QR codes as a way of just kind of monitoring use of them as well. Yeah.
So I would love to add.
Can I just comment on the Twitter polls?
Mm-hmm.
The idea is that it goes out from, well, it can go out from any organization, but one of the thoughts was they will go out from one main Twitter account, and then people will retweet from there, because that's the best way that we'll be able to monitor the responses. So the account that it will, I don't know if Louise mentioned this because I was out of the call for a few minutes, is that it will go out from the UK CPA Pharmacy Infection Network account. Other accounts can put up the polls as well and use the polls. But if we want to try and get as much information as possible, it's always helpful if you encourage your comms team to retweet from that account, and we'll share those details as well.
And now, Louise, you can feedback as well, please.
Thank you.
Louise?
Aoife, I'm here. Can you hear me?
Yes.
Say thank you to the people in breakout room 1 for your patience. It was I appreciate it, and we had some good discussions. We had colleagues from sort of the social care side and also from the GP surgery side, so it allowed us to have some discussions. Very much the messages were, as our colleagues have already said, sort of the challenges around COVID and being able to release people to go to training, lots of pressures on everybody's time, and also, as you talked about, whether or not any messages about COVID get diluted down through everybody else's. So it's trying to make sure what is the actual sort of priorities. So we talked a lot about sort of lessons learned from previous projects, and sometimes at this moment it's the difficulty of actually being able to have face-to-face discussions even through virtual, because people can't get the allotted time. So we talked about sort of the role of maybe newsletters, trying to amalgamate the information that people can then access in their own time, in their own way, how it fits in with their day. And we also talked about bringing in sort of colleagues that traditionally didn't necessarily be in that particular area. So, for example, the new pharmacists and the pharmacy technicians that are in the PCNs, and how they bring wealth of experience and also opportunities to use new resources and untapped resources. So we talked about those kind of things, and then we talked about how you'd share the information afterwards, and people were very excited about sort of the Antibiotic Guardian platform to be able to share, but also thinking about Pharmacy Congress and how there's a sort of different opportunities, and like you said about FIS and HIS, we talked about that. And we also talked a lot about the Target workshop, very well received, people really enjoyed that and sort of thought that was very useful ways going forward, and people were very keen to learn more about the schools project and try and work out how to do that. And we're also about trying to share messages with the patients, whether that's through a text message initially, which opens up that dialogue and then can maybe signpost to appropriate resources. So we were trying to think of ways to reach out beyond the healthcare group as well, to try to help reinforce information to the patients. It was a good discussion. Thanks, Aoife.
Thank you, Louise. So I'm going to go back now to my own breakout group. So interestingly, a lot of stuff we focused on in the group was around the engaging with schools. And one really interesting point came up was actually that EBUG not just applies to primary schools, but also is for the resources for secondary schools. And especially when supporting STEM work, you can do debate kits with Year 9 students, which is a really good opportunity not only to engage with vaccinations, antimicrobial resistance, but also encouraging the people to understand about the profession of a pharmacist and actually how you engage with that. Another thing that's mentioned was if you're engaging with schools is that they plan their autumn term, their November, in around June, July time. So if you can, engaging early was a good tip. Other thing to talk about is actually how to engage with the local GP practices, and that with being virtual and actually the consultations only being 10 minutes, sometimes GPs find it difficult to share information with patients in a way that's more receptive and that they'll engage with, and that sometimes they find that leaflets are thrown in the bin afterwards. And other than that was also importance of engaging with your local communities. So having resources that are the resources not just in different languages, but are they sensitive to needs of communities, and appropriate messaging for that. Other things we're talking about is actually how do you engage? So getting involved with the local BAME forums, focus on reducing inequalities. One suggestion was if you're going to a shopping centre to talk about resistance, maybe have a funny bug costume. Not so easy in COVID, but something that people can really engage with and remember. Another thing I've mentioned is that the Islamic Society, I think this morning, released information on the flu vaccine, because it's got a porcine component, and that they've said it's suitable for use in population. So with that, we were talking about how important it is to encourage vaccination and how we can even distribute leaflets when every time a child sees a nurse for vaccination, or thinking about every contact that families and children have with the health service. How can you use that to share information? Other things to talk about is, so some of the barriers are, of course, social distancing, what's going on with COVID, and also, like other groups, how do you share information at this time? Some things I found interesting about learning was that people didn't realize how many resources were there and what they can use. So, and actually how much relief people get from realizing there is much more than they expect from this. And other things, and then we're talking about with sources for sharing information. One thing was mentioned was Pressquip, and that under safety, you can submit projects to the Pressquip Awards to share good work in antimicrobial stewardship. So that's also a good opportunity for primary care. So yes, so that's feedback from my room. And I'm just looking at 25 past. So and one thing I will mention is I'm going to look back through all the comments, and if there's anything that I can share afterwards or take from those comments to link to an email out resources that people need, I will do that after the workshop, just to help people with whatever they're looking for. The slide sets are also going out to everyone. Anything else, Dan, or do you want to close? Or
Yeah, I think there's one more section there, which is about the action planning. If we,
yes.
And just to say, massive thank you to, it's really great to see that we have colleagues from, I mean, we started with 105 individuals, and we still have more than 70 people on the line, which is great because it means that people are still engaged. We know that individuals have had to go back into to their clinical wards and various places. So it's really, really good to be able to share that you know, we still have colleagues who want to do this this year, be understanding that there's several barriers. As we've said, you know, the resources and tools that are developed nationally are there for use. And very good point about the toolkit and the importance of making sure that they're published early. It's our aim every year to try and get them out as early as possible in September. But usually something will challenge us during that year. But what we found is that, and what's happened through is that we know that comms can respond very quickly when they choose to. And most of the resources that we're putting out, there is no real new messages in terms of the principles are the same. What may change, and the branding is staying the same this year. So there isn't really there shouldn't be any major challenges in terms of the messages. So in terms of action planning, I would love to hear, or let's do a quick poll by using the raised hand. How many people have started their action plan document? How many people have used the document as well? So if we use the raising hands, we'll use that rather than the chat. Oh, I can see quite a few people. So excellent. So it's really good to see that several of you have you know, started to do the action planning. So, I mean, and that's really helpful. It'll be great if you can share that with us. We'll share with you a way that can happen, so that we can provide that. All the information we collate, we do share back, and it's always helpful when we can tell NHS England leaders and PHE leaders that, you know, colleagues in practice are still committed to tackling AMR. There's still action planning for World Antibiotic Awareness Week. So please do share this information with us. So I can see that we have many hands up. Probably about 17 maybe, or people are beginning to put their hands back down. But yes, so quite a few people have said that they have started the action planning. The other thing, the other point to highlight, as Aoife said, we'll share the recording. We hope that it's worked, and we will also share the slides with you so that you can click on those links. Please go ahead with planning your week and your activities. This year is a challenging year. We're very aware of that. Even if all you can do, or all your organization does, is retweet or participate in the Global Twitter Storm, or just puts our, you know, anything that we do will add to the collective approach. The aim is not to put more pressure on individuals. Please do not take it as that, you know, and we're not trying to confuse the messages as well. So we have to be very aware of that. But what we're trying to say is that even in the context of COVID, especially in the context of COVID, antimicrobial stewardship is still important, and we still need to have some focus on it. I am going to stop there now. I'm going to say thank you very much once again. It's now 1:29. If there are any questions, I will have a quick look in the chat box and I will try and respond to them. But the aim of this is to allow you to all to finish promptly so that you can all go back and have some lunch and also go back into work. So we've got some details about being useful. Was quite useful to complete the action plan document with our comms team. Oh, excellent. Tammy, that's a really interesting point that you completed it with the comms team. Please do share with us your learning from that. That will be helpful for us as well. And I have to say, I've been leading World Antibiotic Awareness Week and EAAD for about 10 years now, which is the length of time I've been a PhD. And I got to the stage where you know, when you've done something for so long, it's difficult for you to come up with new ideas. I've done that for a few years, but this year I'm particularly grateful to Aoife. He's a clinical fellow at PhD who has driven, and Jordan and Ella as well, but particularly coming up with the idea of having this webinar. I've done several webinars in the past, but it didn't even occur to me that this could be one way this year. So thank you to Aoife for leading this so well and doing such a great job. And thank you to Louise as well for chairing the subgroup of the national group so that we can develop resources that can actually be really useful in local practice, and they are practically useful for all. Thank you to all the presenters. Thank you to all the facilitators. I am very grateful, and we'll be feeding back. Fine. We will send you out a survey so that you can share with us your learnings from this event and how we can improve, because we always look to improve. Somebody's asking, is there a generic action plan document? Yes, so that it was sent, a blank action plan document was sent out to all those who registered, and we can try and make sure that it comes back out again. Okay, if there's nothing else from me, back to you, Aoife, and then we can close the meeting.
Brilliant. I'm just going to mention, if you have any other questions for any speakers, if you email SBAR, I will facilitate any questions and contact that way. And I've done just put a link for Target Toolkit, but thank you so much for attending and being so engaging with all the breakout rooms. It's really been fascinating hearing about what's going on locally and how important that is. I was going to check, there's a hand up for Samina. Can I just check, is that on purpose or is that just by accident? It's gone down.
Apparently the word is legacy hand up. That's the online term for it.
Yeah. Okay. Well, as you haven't spoken, I'm assuming that's a legacy hand up, but just to thank everyone so much, and thank you so much to speakers and facilitators for all their help, and thank you, Diane, for actually being such a good mentor and actually helping me put this together.
Okay.
Thank you.
Bye, everyone.
Thanks, everyone. Bye.
Thanks, Diane. Bye.
Bye.
Thank you.